This is Professor David Bishai going through the second half of our lecture on the SDGs. And in this part, I'd like to cover both collective impact as well as a description of why this approach makes primary health care a good way of realizing the Sustainable Development Goals. What is collective impact? Collective impact is a way of convening many of a community's chief stakeholders in an enabling environment where they all bring together a common agenda, a shared measurement system, mutually reinforcing activities, continuous communication, and backbone support. These are the 5 basic building blocks of a collective impact approach. It is a way to form a coalition of both government agencies and non-government agencies who want to work together on something like a sustainable development goal. This enables a community to achieve coherence and coordination, and it mobilizes resources from inside the government as well as in society. So let's take them one by one. With a common agenda, the partners have to communicate with each other and talk about the problem. They have to share an understanding of what's causing the problem and share a vision for change. Once they can speak the same language, they can go to the next step and work on shared measurement. In that part, they will collect data, they'll measure results, and they'll share accountability. Using data, they can move on to mutually reinforcing activities. This is a strategy session. This is where they will make a work plan where people with strengths in one area will work there, and people with strengths in another will coordinate with them through a joint plan of action. This is where public-private partnerships take place, where the government does what it's best at and private partners do what they're best at. They have to stay in communication. So building block number 4 is consistent and open communication. People have to talk to each other and say what they're doing. And so if some of the partners are a little bit opaque and don't share, it doesn't help build trust. And this might be hard for some government agencies that feel like they would be criticized by sharing what they're doing and open themselves up to opposition who would take advantage of their openness. Underlying this approach is something called the backbone. This is the host or convener who brings the partners together, may or may not have all the money, but is the executor. And they have staffing with resources that does the convening and keeps the train moving. All of this approach to collective impact is written up in an important paper from 2011 by Kanya and Kramer in the Stanford Social Innovation Review. Let me talk through how one might apply this to a problem here in Hong Kong. Heat health emergencies are typical around the world, and they're becoming more common. A sustained heat wave with high humidity and heat for 5 or more days takes a toll on people's health, and it kills more people every year than typhoons, earthquakes, volcanoes. It kills more people than any other natural disaster. The people who die in heat waves are poor, they don't have access to air conditioning, they're mostly over 60 or 65. Some of them are outdoor workers who don't have jobs that will let them take breaks and cool off. It's a problem in cities, it's also a problem in rural areas. It's a problem when people live alone and can't get cooled off. One can solve heat health emergencies' death toll. Obviously, we need to solve climate change, but in the meantime, we can make heat emergencies less dangerous by an action plan where we would establish the phone numbers of the seniors living in the community who don't have air conditioning. In addition to the list, we have a bank of volunteers from different agencies, churches, schools, universities, who can help the government call or bring people who are in this high-risk group to a cooling center in a heat wave. Cooling center doesn't have to be a public. It could be your nephew's house or somebody who you trust and know already. What typically happens that doesn't work is you put a notification in the television and say it's going to be hot, go and get cool. Old people don't listen, and they say, I survived this many years, I can survive another one, and that's who gets vulnerable. So just blasting out the information has been proven to be ineffective, and one requires a pre-existing plan and a lot of education for the seniors on how they get more and more vulnerable with the extremes of age. So we have experience with building these heat health action plans in other parts of the world, not Hong Kong, but to build a network where we form partnerships that would work together to make the plan. They would obviously need to work with scientists who can say what combination of humidity and heat is the most dangerous and what the heat index ought to be in a local neighborhood. Those same meteorologists would be willing to publicize when the heat index gets above a threshold. There have to be individuals with expertise in communication and outreach, and there have to be individuals that have the bank of volunteers. So multiple agencies, and it doesn't really fall to a typical health department or even to a weather department. It's really cross-sectoral, and it doesn't have to be all government. Here in Hong Kong, we're very vulnerable to these events. Because of aging and housing, we're seeing an incredibly high number of seniors living alone right now, up to 538,000 seniors living alone in Hong Kong. The trends in temperature, don't have to bore you with this. It's getting hotter in Hong Kong. We're more likely to get up into the 36s every summer. And here you see these summer heat waves getting hotter and hotter. The blue summer heat wave was 2023, which peaked up at 36 degrees. And the trend is such that this will just keep getting hotter for the rest of the century unless climate change is mitigated. Stakeholders in Hong Kong come from a variety of sectors. We obviously want to work with the Hong Kong Observatory, the Environmental Protection Agency, Center for Health Protection. My own goal would be that the Center for Health Protection becomes the backbone agency, convening through the multiple other sectors through a collective impact approach to the Heat Health Action Plan. So health departments can play a central role. They can be the people who take this on because ultimately it has a very important health impact. And this could be the future of public health practice. So last month I gathered a group of students here at Hong Kong University. They're calling themselves Hong Kong Unite, Hong Kong United Against Heat Health Emergencies. And we're meeting on a monthly basis to work out advocacy to try to convince our health department and Center for Health Protection to implement a collective impact approach. In successful collective impacts, the community is importantly fundamental, that it's doing it with the people. And instead of this being a top-down, the experts will give you a heat health action plan. We really want people in the community to work with Hong Kong Unite. So it's not just the experts doing it. We're looking for something that looks like a neo-patrician working with the community groups in order to get the energy and the power. The obstacle is that, people don't see things the right way, and there's this science to working out those differences. So a way forward is for a public health agency to check its capability to do things like this, and I would advocate that our Center for Health Protection might want to go through a checklist of its readiness to form collective impact. If they self-assess, they might return to their essential public health functions and find that they're weakest at community engagement. If they find they're weakest and they're committed to progress, then we could start going through a collective impact approach. Once you're doing collective impact, you can evaluate it over time. You could start in the early years, evaluating early performance indicators. What progress have you made? For whom and how and why? And in the middle years, you would see these processes change, and you would go through indicators of systems and behavior change. And then finally, later on, you'd be able to measure impact towards your ultimate goal. Well, let's close off our session with talk about the alignment of primary health care and SDGs. Primary health care, when we say it's comprehensive primary health care, it includes the delivery of primary medical care services with this comprehensive whole of society approach, emblemized by collective impact. How does that align with the Sustainable Development Goals? Well, here's just a few of them. I'm not going to go through all 17. But if we want to end poverty in all forms everywhere, these would be the essential public health functions that make the most difference there. Essential public health function number 1 is to monitor health status, and you would again monitor poverty that way. And mobilizing community partnerships to work on coordinating the agencies of government addressing poverty and linking people to health services. So these essential public health functions, if they're part of comprehensive primary health care, are part of our solution. Ending hunger also can be achieved by monitoring health status, developing policies and plans, and enforcing laws. Number 4, ensuring inclusive and equitable quality in education. Obviously, this is for an education department, not a health department, but the technology of the system of using indicators to monitor the status of schooling, informing and educating, and researching is, I think, helpful and a complement that people in public health can add to what's going on in education. The empowerment of women and girls, it's a gender issue, but I think public health and the essential public health functions complement it in a powerful way. And if we want to empower women and girls, we do need to monitor their status, develop policies, mobilize the community, and evaluate and assure effectiveness, accessibility, and quality of preventive health services. If we want to work on sustainable production and consumption, we want to have environmental activism. Again, the public health approach using monitoring, informing, and developing policies is very effective. If we want effective, accountable, and inclusive institutions, same approach. So the essential public health function approach is fundamental to carrying out a lot of the SDGs. So in summary, complex problems in society need both a top-down and a bottom-up approach. Accountability and expertise from the top-down approach is great. We want to keep that at the table. Trust and inclusion coming from the bottom up is important, which is why we need to be inclusive. Bottom up is harder to accomplish, and it's going to get crowded out with an exclusive focus on expert solutions all the time. Final bullet is to see that public health can have a central convening role as a backbone if we were to implement a collective impact approach.